Yeah, so.
Thank you, Makunda. So good evening, everyone. So I'm going to share some little information about the USAID PS3 Plus. And PS3 stands for Public Sector System Strengthening Plus Activity or project in Tanzania. And we are working in both mainland Tanzania and Zanzibar. So I'll present quickly in the interest of time. And so this is the implementation strategy for the PS3 Plus project. And they are working with the ministries, starting with Minister of Pure, Minister of Health, Minister of Finance, and the others. And also are working with the regional authorities, but also local government authorities, health facilities, but also we have the frontline service providers, where the facility governing committees and the others are sitting in there where actual services are offered. But along, we're also linking with the community space where issues of service utilization, the citizen engagement and feedback are happening. So there's this kind of complementarity from the community level to the facility level, to the local government authority, regional level, and the national level. So our interventions cut across those. And the end point is really improving service delivery across sectors, being healthy, education, agriculture, and the like. So PS3 Plus is a cross-sectoral project that really cuts across a number of sectors. Next. And the project is driven by three main result areas. And these are, you can see, improved evidence-based inclusive planning and management at local levels, but also strengthen the local governance to promote citizen engagement and accountability. And we have result area number 3 that focuses in really increase the efficiency in the collection and use of the financial resources. Next. So I'll take you quickly through some of the key achievements, though we've been in the game for quite some time and therefore want to be able to spend, to speak about everything that we did, but we'll give you a high level of what we've done so far. So in the side of the health sector per se, we've been working with PRALG, the President's Office, to support patient management information system. This one is the EMR, and nowadays also going to the level of the EHR. And this is Government of Tanzania Health Operations Management Information System, version 4. But now the government has endeavored into a centralized version of the system. And through this, we have been able also to provide technical assistance to incorporate a number of other disease programs into the system. These include HIV, TB, family planning, into these centralized dichotomies. And here you'll see actually some of a diagram from the director of PRALG, Mr. Eric, that shows where actually how many facilities are still using the system up to now. So you can see the central version, which is quite new, is now with 1,285 facilities. But the data I'm given by Tanda today, we're almost close to 3,000 facilities with the central version. And the other ones are old versions. And what the government is doing now is to migrate from the older versions to the central version, which is quite up to date and quite new. Also, we are working with the UCS, the Unified Community System, as one of the key systems. As I mentioned earlier, we have system work that is going to the level of the facilities and also to the level of the community. And with UCS, we have been tasked by the USAID to support the Lift Up initiative, but also the gender-based violence, orphans and vulnerable children, and the gender equality modules. These are some of the new modules within the UCS system. And up to now, the UCS has more than 17 modules. So those 3 are part of those modules that we've been supporting, but also working to improve the dashboard and the in-apps reports of the system, whereby now the dashboard is able to produce or to share information from the facility level and the community level at all. But also, as you know, there are cases that are happening at a facility and those that are happening at the community. So in order to be able to manage those kind of referrals, one has to be able to track issues that are coming from the community to the facility. And so the UCS is there to facilitate this kind of movement where a patient can be referred from a community to facility level. Next. Next. So this is just some the dashboard that shows like how the modules are, like family planning, ANC, PMC, HEI, referrals, and the others. So those are some of the issues that you will see within the system. Next. And so this is the up-to-date data. This data is from today. And from here you can see how many clients have been registered to date. So 1,137, 195 have been registered clients up to date. And then in terms of number of officers using the UCS system, you can see the numbers. But also the community health workers who are using the UCS system. This data is actually from this afternoon. You can see how the number is actually getting up day after day. This is just October. Today is 2nd. And they've been able to see 2,355 clients who have been registered within the system. So here you'll see how the UCS is really coming up, and this is really a very helpful tool to support self-delivery from the community level to the other levels. Next. Yeah, as Mr. Makunda also mentioned, we've been supporting the planning system, and we've extended this planning and budgeting system to primary healthcare facilities, schools, lower level of the government, OLGs, to improve self-delivery. And the system is up and running now for more than 5 years. The government is using the system for planning and budgeting purposes. But also, we have it has the part of the CCHP, the Comprehensive Castle Health Plan, that is there, but also for agriculture, there's also agriculture sector strategies within the system. So now you're able to see and capture this kind of information. If you want to see how much amount of money is spent or is budgeted for different actual interventions, you'll be able to see. So like now within the system, we'll be able to see reports for disease programs like the HIV, TB, malaria, family planning, and the like. And all these are really within the primary healthcare facilities in the other levels within the planned up system. Next. So this is also just a dashboard. Next. Also a dashboard just shows interventions and how much amount of money has been budgeted and also spent. So also we supported another facility level system, and with the government coming up with the Director of Funds Financing, we came out with a system called FAST. This is the Facility Financial Accounting and Reporting System. And really the system focuses more on the financial management at a facility level in terms of how much funds are received and also the expenditures, but also is able to provide this kind of reports that are to be consumed by ministries in the other levels. But also, the system is able to receive plans and budgets from plan rep, but also it sends funds that are received and expensed to plan rep and the other expenditure level systems like Kimuze, mfumo ulipaji serikalini. Next. So this is just also the dashboard for FAST that you can see the way the transactions are moving across and how the dashboard is in terms of cash management, chart of account segments, and also planning and budgeting and the like. Next. So also this shows, as I mentioned, you will see the amount of money that have been received, the revenues and the like, but you also will be able to see what kind of payments are being done and so forth and so forth and so forth. So the system is quite easy to use, and now like in mainland, all the money that is sent from the central level government goes to these facilities. The facilities have the bank accounts, so they're able to receive money and also to plan, budget, and make use of the funds. Next. Okay, so also we have gone to other systems like the financial tracking and the internal audit management systems, and also the revenue collection systems, which have been working with the government together to improve this area also as well. Next. Next. So this is also the part of interoperability. As we might speak, I know Director Elomo is here with Eric. We'll speak more about Muungano Gateway and also the Health Information Mediator and the other gateways that actually are supporting implementation of the systems at the country level. Next. Yeah, we've been also working with the government to strengthen the universal health insurance, and in terms really the act itself, but also the benefit package and also the health prepayment mechanism and the like. And I'm sure Mkurugenzi Match is here with us, and much will be said. Yeah. 3 minutes. Next. Also about direct facility financing implementation, as I mentioned already, it's also an area that we've been supporting in terms of technical assistance, and we've been co-working with the government in implementing this in terms of the health facilities that are receiving the health sector basket fund, the NHIF reimbursement and the like, but also extension of the PFM, public financial management systems at different levels of health system. Next. Yeah, so also this is the side of agriculture that I want to talk about. I'll talk it later. Next. Yeah, so another area of interest is really on citizen engagement. As we are doing a lot of work with the systems and the like, we also support the CSOs and the LJs in terms of communitization and different services and the communities and the population at large in terms of service improvement, in terms of sensitization, website development, but also we have the business council boards and the like. All these are really to share more information about what is happening, the OD process, and how really the government can make use of these issues to involve our community at large. Next. Yeah. And lastly, well, I'll talk about the installation of the user system support, and we've been working to introduce the help desk system across the country. We have one at the PRG headquarters, and in each region, 26 regions of mainland Tanzania, we have the help desk center systems where already the equipment's in there, and the channels can be forwarded to from the regional level to get kind of solving issues that are happening in terms of system usage and the like. But you also have the open distance learning, the ODL platform, that is really there to facilitate users in terms of orienting themselves, the use of systems and the like. Next. So this is just some of the courses that are already in the online distance learning system. Next. Yeah, so lastly, I'm talking about Zanzibar, and we've been working with the government of Zanzibar and the IGA directors here to support the development of the planning and budgeting system, the ZAN-PBRS, but here it's called BAMAS because it is budget na matumizi. So this system is actually up and running, and I'm sure the director of IGA will speak more about it. But also the patient management information system, the ZAN-EMR, that went to 10 facilities in Zanzibar, and also the health facilities register system that is also in the process of being finalized. And finally, we have the Zanzibar technical team on systems, especially for the ZAN-EMR and the planning system in terms of capacity building, whereby the government team is able to do all this kind of work on their own with only little support from us because of the capacity building work that have been done to them. Next. So this is just the dashboard for ZAN-PBRS for Zanzibar. Next. Yeah, so some of the key achievements, I could say really the success factors behind this all is because we are working by using local programmers and system analysts. And I think even with UCS Director Elomo is here, we have the Minister of Programmers who are now up to speed, knowing how the system can work. The same to Zanzibar and the mainland with Eric's team. But also they use the approach of the blue rooms, where the team sits together in a place, they develop a system together with the government, and then they roll it out. And we've been using the agile methodology in terms of continuous improvement, the Kaizen and the like. Next.
Thank you very much, Desiree, for the good note, because I know we don't have a lot of time here. So please join me to just do a round of clap for Desiree for a very good keynote speech. Thank you very much. Yeah, so before we proceed, Desiree has mentioned a lot of enterprise systems from agriculture, education, health, among others. Most of these systems are enterprise. They are not vertical, but they are cross-cutting. But always, the government of Zanzibar and government of Tanzania has been on the driving seat. In PS3 Plus, under resources from us, USAID has been the trusted advisor to ensure the government realize their dreams. There's a very good relationship with the two governments to ensure they have very successful implementation. So with that, please allow me to welcome on stage Mr. Saidi, who is the Director of E-Government in Zanzibar, to say a few words before I bring on stage our panelists. Mr. Saidi, the floor is yours. Please welcome me to welcome him on stage.
Uh, Let me say good evening, everyone here attending this session today. I know it's evening, and I will not ask people to stretch, but we'll go right to the point so that we can save some time. So, first of all, welcome to Zanzibar. This is a wonderful opportunity to be here today with you. So, thank you very much. My name is Said, the Director General for Zanzibar E-Government Authority. And E-Government Authority is under President Office, State House. The role that we're playing for the government is pretty much to oversight all the government initiatives. So we're looking at how we can do the best for the Zanzibar in terms of the utilizing ICT to get to the role of a digital transformation. Now, digital transformation is the journey. It won't be started just get it right over there for only one day. It's a process that needs to be very well focused. It's a journey, and since the government has a lot of government institutions, it has a lot of entities, and the digital transformation, it does not just go with one government entity. So it's a role that we play as an e-government to make sure that we all get there. Within that journey, not others are crossing the different, going to the left, others going to the right, others going to right into the middle. So we just need to work together. And that's overall the concept about it. So we appreciate the effort, because the government cannot do it alone. It needs partners, and it needs strategic partners in order to get there. And we appreciate the partners who are with us. Some of them are here today, some of them are not here, but we appreciate all of them. It won't be fair if I just mention some of them, but of course, USAID, PS3 Plus, there's a D3, there are a lot of others, which I want to put an apology. I won't be able to mention all of them, but however, we appreciate the efforts, the support that we gain. But from the government side, or from the role from the e-government, we really much ask for the coordination on these efforts. We made so much effort so far within this journey, but we need to reach there, all of us together. And with the support that I see so far, the speed, the momentum, I have no doubt we'll get there faster than we anticipated. And with that, I want all of you to just give a round of applause, because this is a lot of work has been done. I can mention some of them that made a real impact. I won't say some did not make an impact, but I'll say a lot of them made a lot of impact. So, first of all, there are systems that, like you call, for the budget and expenditure. This is a national system for the budget. We applied the plan rep. The plan rep was so much help from the others, the partners. Also, my friend, my director, Eric Italy, for the lot of efforts. We appreciate. There was so much support that was done with this one. But now, we'll say Zanzibar is proud. We have a IFMIS system, the Integrated Financial Management System, that is a nationwide, and you can tell there's so much testimony. I wish next time we have a session here just for testimony from the accountant, the chief accountant within the government. They appreciate how easy the system is, how easy for them for the budget and the planning. They make the system usable. So the ZAN EMR, I mean, if you can just look at it, how people appreciate how easy to use the system, how easy for the normal person. Now they will be able not to remember their book, which is a manual process. Now they are able to just walk and then just identify themselves, and right away they go to the hospital, they get the service. So that's what they're looking for. So, and that is all about the ICT. We are making it easier for all these processes. So the journey is about the paperless, right? We are looking for how we can really transform the nation, the overall Tanzania, Zanzibar. How can we go into the paperless? So then we forget about all these using papers. At the same time, it's the saving for the government. So there's a lot of effort that are happening. And I see my friend from Access there. So I just want to say hello, Dr. Harry and the others. I want to say hello for the efforts that you put to there. So we have to move to paperless. How do we make it there? So we still need help from the partners and others to really help us to get there, because it won't be easy for just government to overall make it all that happening. Now, I will not forget about the Jamii Afya. Jamii Afya made a huge impact, because what it's about is the digital way of the national community health program. Now, a lot of support from the community health workers, how they're able to do their normal work by using their fingertip. So they do not have to use manual process anymore. Now, we talk about the Zanzibar Universal Health Fund, ZHSF. It's a lot of support from different partners there, and we appreciate that, because now the community can see the difference. And when we talk about how as a government really support how they utilize the ICT, and this is one of the thing. We don't just build the digital system. It has to make an impact. So that we're looking for, and we can see from there, from the testimony from a lot of the communities out there, they appreciate the effort that has been done so far. But again, I will say there's still more work to be done, and I think that's part of the reason we're here. We are, from the government side, we are still asking for more collaboration so that we can reach this goal much faster, so we can bring that transparency, we can bring that innovative way of doing things. So I want to say that the help that we are seeking for is more into the coordination, so we're all walking along the same line. So with all that, I want to appreciate all of you for being here. I'm asking for more. Let us go within this journey together, so we reach there with the real digital transformation. So thank you very much.
Thank you very much. Tumpigie makofi mengi sana mkurugenzi wa IJA Zanzibar. Yeah, so with that, ladies and gentlemen, now let me take this opportunity to welcome on stage our panelists today, whose insight and experience will make this session very, very interesting. To start with, please join me to welcome on stage Director Eric Kitali. Eric Kitali is a seasoned ICT leader and a certified enterprise architecture with a proven track record for over a decade, driving transformative change in Tanzania public sector. The other round? Yes. Sorry. As Director of ICT since 2015 at PRI, he has been instrumental in implementing strategic and critical ICT system nationwide. Kitali expertise in including public finance systems, planning, service delivery, governance, data management, information sharing, and human resource management. After Eric on the stage, please allow me to welcome Mr. Silvanus Ilomo. Ilomo is the Director of ICT at the Ministry of Health. He's a senior system analyst with 10 years experience working in Tanzania health sector business transformation towards adoption of digital products. After Ilomo, we have Sarah Ngibwazi. Sarah, please welcome on stage. Sarah is an internal auditor at Chamwino, DC, Dodoma, with over 16 years experience in providing assurance and consulting activity on governance, risk control. Sarah has been assessing the effectiveness of efficiency of systems including MUSE, PlanRep, FAS, Cotomis, Tausi, among other internal control information systems. At SARA, we have Dr. Jemini Mtei. Dr. Jemini Mtei is coordinating the overall implementation of USAID PS3 technical intervention, including those related to strengthening cross-sector information system, public financing, including improving strategic purchasing, resource tracking, revenue collection, budgeting, planning, reporting, and expenditure management. Furthermore, we have one more colleague here, whose name is Mr. Ali Idrissa Shamte. Shamte is working with the Office Chief Government Statistician for nearly 20 years before joining Zanzibar Health Service Fund in 2022. So this is the complete list of panelists today who are going to share with us their experience. We know we don't have a lot of time, so I'll try to be as brief as possible. So to start our conversation this evening, I'll start with Director Eric from PURAC. Eric, looking back over the last 5 years, what do you see are the impact and also lessons learned from the investment in strengthening digital systems such as the Government of Tanzania Hospital Management Information System, Plan Rep, Facility Financing Accounting Systems, the Unified Community Systems, among other systems?
Thank you very much, moderator. Eric Tari from the President's Office, Local Government and Regional Administration and Local Government. You have asked me two issues, the impact and lesson learned. And you mentioned there were around 5 systems. I'll go for 3 and my colleagues will go for others. And I can start with FAS, Plan Rep and Go-TOMIS. In terms of the impact, I'll start with first the coverage. Actually, FAS system is covering more than 35 facilities across the country, including education facilities, health facilities, and others. Plan Rep is covering more than 300 facilities, mainland and Zanzibar. If you go to Go-TOMIS now, is covering around 4,000 facilities. Now, the impact in terms of coverage is that way. Impact in terms of auditing and transparency. Using FAS system, we are now able to track the finances of all these more than 35,000 facilities across the country. Education, health, etc., etc. Using Plan Rep, we can even track the planning, the budgeting to the level of GFS code across the country. And as you heard from the DG from e-government Zanzibar, even Plan Rep is ready in Zanzibar. So we are able to track all this budgeting, planning, etc., etc. But also in terms of the impact, using all these systems, we can even track the productivity. Productivity in terms of workers who are working in these facilities, including health, education, and agriculture. Again, in terms of participation, you know, we have to include the citizen when they are doing the budgeting and planning. Within the Plan Rep, we were able to include and embrace O&OD, opportunity and obstacles to development. So we are also engaging the citizen in terms of planning and budgeting. Now, those are a few impacts without diluting what my colleague Desde represented earlier. But in terms of lesson learned, actually when we were developing these systems, first and foremost, we embraced on the co-designing. Actually, we designed for and we design with those who are going to use the system. So the co-designing is really important. And when we are working with partner, we have to make sure we even put the issue of handover when we start the co-designing of any system. So the Plan Rep, the FAS, the Go-TOMIS, we embrace the co-designing and including all stakeholders in that particular gesture. Another thing which we have done at the lesson learned, it's embrace continuous improvement. the Kaizen principle. My friend Desdere likes it very much. Actually, for instance, the FAST, we started using FAST since 2017, GoToMIS 2013, and Plan Ref 2017. You see, we keep on improving every single day, and that is really key and really important. Whenever there is any issue, we will have to improve the system and not coming up with new system. You know, we have different partners and colleagues here. We have this problem called the pilotitis. Pilotitis is keep on coming up with new system and coming up doing pilot every single day. So with Plan Rep and FAST and GoToMIS, continuous improvement is really key. Another thing which we have put into these systems is embracing global principles and local practices. If you look at the way we are designing our systems, you know, we are including our local settings. Sometimes you have facilities which are within the resource limited settings. So we include all those when we are developing this system. For instance, if you go abroad like US or UK, something like offline mode, you cannot find it there. But when we are doing designing of our systems, we embrace on the global practices, but global principles, but local practices. Another thing which we are doing as a lesson learned, it's perfection. You know, sometimes, you know, you can look for perfection and you find you keep on procrastinating. And for us, if it's good enough, and we don't allow the perfect to be the enemy of the good. So if it's 70% good, then we go for it, and then we keep on improving. And my colleagues will add more. Lastly is we don't allow alternatives. If we say every facility is going to use FAST, every facility will use FAST. If you provide the plan B, almost and always people will go for plan B, because most of the time the plan B is easier and it's shortcut comparing to plan A. So there's no alternatives when we come with this system which we are implementing at the local space.
Thank you very much, Eric. You embrace the global principle, local practice. If it's 70% done, it's ready to use. It meets technical needs, but also programmatic needs. So Ilomo, the same question, please, if you can add more detail, but also our auditor after Ilomo, then I'll shift it to another gears. Thanks.
Oh, thank you, moderator. My name is Silvanus Ilomo. I'm a director of ICT, Minister of Health. I think like Mr. Eric has made a touch with systems from the side of PORAG, but also we have the same kind of initiative that we are running at regional referral hospitals, going upward to zonal, specialized, and national hospitals. And what we did is we deployed a digital system which is called AFIA EHMS, of which as of currently for the part of lesson learned, we have already integrated AFIA EHMS with all medical equipment for the level of regional referral hospitals. But also right now we are making like a centralized dashboard where our top level leaders like permanent secretary, ministers, deputy minister will have a chance to oversee what's going on to the regional referral hospitals in terms of collection, service delivery, quality of service, and other stuff, like also even revenue collection. But also going back to system or data system, we as a ministry have other role of making sure that we are setting some foundation when we want to deploy a digital system. Like we have developed the digital health strategy 2013-2018, but also we come up with another strategy 2019-2024. And currently we are developing a new strategy of starting 2024 to 2030. The aim is to make sure that all initiatives which are running at the government, starting at the level of PORAG to the level of the Minister of Health, are aligned with what we want or what we focus. This is our requirement. So for the first strategy, we do an assessment, and finally, like we have a score of 55%, and then we came to realize that we are developing the strategy with the very big ambitious goals. While there are some stuff like we don't have enough, infrastructure that are ready to accommodate all the stuff regarding to digitalization. So where we come with a score of 55, but the coming strategy of 2019-2024, 2019-2024, yes, which is going to an end. we score like 65%. So you can see there's a gradual change from the first strategy to the second strategy, and now we are running an assessment to oversee what the implementation or the impact of the last strategy we implemented for 2019-2024. But also from the mini side, we do like developing frameworks, as I said, that coordinate the implementation of the digital SS strategy. We develop an enterprise architecture where we are trying to set some a blueprint which sets some architecture or on how systems should be deployed at different levels. As Mr. Eric said, some of the system from PHC up to the Ministry of Health. So what we're trying to do right now, you can see as most of the leaders now are trying to tell us regarding to digital system interoperability. So you see like having this stuff like enterprise architecture will allow us to make easy connectivity of the system from one point to another, because what we're supposed to do is we don't have to make a duplicate stuff and that. So we should have when a client coming from the service level, it's starting the PHC to the national level, should have maybe recognized that this person came from the district hospital, regional referral hospital, is the same person. So right now we are doing stuff like that. And lastly, we do like making some discussion with other offices that could facilitate, because you know that when you set like identification of client, it's not a pure Ministry of Health business. We have like National Identification Authority, NIDA, who are supposed to identify our client to make sure that whenever the client is moving from the PHC service level delivery up to the national level service delivery is recognized as one person. So that's what we have done as a Ministry of Health, and lesson learned from our side. Thank you.
Thank you very much, Director Lomo. Just to highlight what you have said, one on the digital strategy, which is the key document that align the work of different funders, implementing partner, but also providers and the beneficiaries under one single plan under the leadership of the government. But also you have said more about the EMR at the regional referral hospital, which for sure will improve the better patient engagement, but also improve the efficiency of the service we provide to the people on those facilities. That's great. So I'll now ask our next panelist, Sarah, to add few items on the same question.
Okay, thank you. My name is Spaisala Zakayo Ngembozi. I'm here to present about auditing in terms of FASI, GoToMIS, PlanLepo, and MOSE. That technology help much in terms of auditing. The role of the auditor is to add value in the organization and improvement of governance, risk management, and control. We know that this system, when they have high risk, but how the internal auditor can help the organization to add value from that system, GoToMIS or FASI. So the role of the internal auditor is to assess if that system it aligns with the objective of the organization, the objective of the government. The aim of the government is to facilitate work to improve effectiveness and efficiency, so that everyone gets service at time. So we want to know the data or report that produced from the system, is it reliable? Is it accurate? It helps the organization to move, to meet its goal and objective. So the auditor is the one who is responsible to see, to add value, to proactive, to give insight in the organization. That is going on in the system. For the past year and now, there's a lot of improvement. First of all, that system try to minimize fraud, because before that system we use manual work. Most government encounter loss, people tamper with money, because they know data, they can distort that data. But nowadays, if you distort data, there's a backup. There's somewhere data that be stored. Even if you delete in the system, we can trace and we can know where funding go. But previous, it's very difficult, because done manual. You go there, they say no books of collection of revenues. They can distract it. They say they left it, or they are theft. So you are not sure. But management can be colluded from the top up to the down. But now, even if they are colluded, you can find data. Even if they can say that, oh, my buildings have got fire, we can get data. So now, try to minimize the flood. We see that flood is content to minimize, but we cannot eliminate it, or somehow we minimize the flood. And also, from Plan Up, you know what you budgeted and what you receive. So it's be aware to tell the government how to assess our budget. It's going what we planned. We receive what we planned. If there is a difference, we ask why. What can we do? Our project that we planned, it go like what we want. Our community can benefit from our budget. So internal auditor, he review to see and to alert the management. That is why I said that to improve governance. When we tell the board, we tell the government what is going on in our facility, in our schools, in our council. So we identify risk. We assess risk. Management, they have identified the risk. They know what risk can happen from that system, from that good promise. They know risk that can be happening in Plan Lab. Some people can tamper with that system. What control they put there? Is it system operated by one individual? The one who enter data, the one who enter revenue, the one who process payment, the one who process revenue processing payment, the one who process payment process revenue processing medicine procurement. That one, no segregation of duties. It's easy to tamper with the system. He can recognize the inventory that he received nothing. Who checks that? Is there anyone checking the movement of stock from the system? How data input and processing and output? How that programming going on? How that operating and system and analyst? Is there any segregation? Not a system operating data. So, as an internal auditor, is it to identify, are they aware of that risk? What control they put to mitigate that risk? Because the risk is a responsibility of the management. And the control is a responsibility of the management. But the board is oversight to look what is going on. It's to produce a policy and procedure that the management can follow in implementation of their daily activities. So as an internal audit is to see what is going on in that system and to provide advisory or assurance to the management to make more improvement in the operation of their objectives and their goals. So through that technology helps us so much. We can do our auditing even at homes, at anywhere. Instead of going in the field, you can enter in the system, you can produce data, you can see what is going on. If you see there is something wrong, you can ask it and you can take action to the management, you can warrant them. I see there's something wrong there. I see there's something risky there. Maybe I see revenue is down. Why? Maybe people that are collecting not deposited in the bank. They stay with the money in the hands. So the management can take action to make it follow up, to reduce people to enter into temptation. You know, there are something like pressure family, can use that fund for the family problem, can get something, can make him to use it in different ways. So, as an internal auditor, you will be aware on that and provide assurance to the management to be aware on that. You see medicine. Maybe there's a frequent procurement of medicine. Is there an eruption of disease on that time? On that certain dispensary or health? So I give you a warrant to follow up. Maybe that medicine is not out of stock. But people use the way to tamper with money by using what? Procurement. Who check it? So that is an internal auditor to review, to assess that system. Is it operating with our objectives? It add value in the organization. We go in the schools, we're fast. Now they have a project, we see what is going on. Why no implementation of project? Well, there's something wrong. As an internal auditor, you go to ask him, why? No anything going on. Is there something wrong? So you warrant a management to take what? Action, to put more control, to improve their control. If they are weak, you advise them. Maybe you come up with a strong control so as to minimize that loss, wastage of resources, flood, even corruption. Because when you see, you cannot put much control on that, you allow corruption and you allow people to collide. When two people collide, it's very difficult to find flood instead of one person. Because one person, you can identify flood according to the life changes, lifestyle, behavior, but if they collide two or more than two, to be very difficult. So as an internal audit, all of the time, we're aware on that things, to identify red flag, what is going on in our system, to know what to do it. So That technology facilitates more improvement in your organization, facilitates more improvement in auditing, and facilitate more in the improvement of the government operation. Most of the funds that released that is a low level now go direct to the community, and we see now a lot of improvement. We see schools increasing, health, social services have much improved now. People get medicine, people they get the service, education. They have a lot of school. Because why? Because of technology. It's very difficult to match people to tamper with oil money, even if you cannot eliminate typically fraud, but somehow the government tried to avoid so much in fraud. Thank you very much.
Thank you very much, Sarah, for that. So a few things to underline here: efficiency and effectiveness of these systems, but also improve the accuracy, minimize fraud, system control, and all this meets both technical needs and also the auditing programmatic needs. Thank you so much. So with that, let's shift gears a little bit more now. And this next question will go to both Gemini and the earlier bed. This question goes like this. What are the key remaining gaps? From what you've heard from Desderi, from the three panelists here, what are the key remaining gaps in digital health transformation to accelerate progress toward achieving universal health coverage? In Tanzania mainland, in the context of the Universal Health Insurance Initiative, and also in Zanzibar through Zanzibar Health Service Fund. So I'll start with Gemini, then Alibet. Over to you.
Okay, thank you, moderator. So we've heard a lot has changed in terms of digital transformation, and now our country is shifting gear toward universal health insurance, both in the mainland and in Zanzibar. So in the mainland, we already have the UHI bill. So the business at hand is to make sure that every citizen is enrolling to health insurance. So there comes the first gap, because you're now expanding health insurance coverage to a population of close to 60 million, to 65 million. So what it tells you, the first thing is we really need to strengthen the digital platform to facilitate that aspect of enrollment, because you need to be able to capture people from the formal sector up to the lower level government, to the community level. So for a system to be able to manage that kind of population, you really need to invest on technology. And on top of that, one of the challenges that is discouraging most of the people to enroll to these health insurance schemes is the process of enrollment. If you have a cumbersome process that is really bureaucratic for people to get into the health insurance scheme, you're not going to see people enrolling. So we really need to invest on the digital platform to come up with simple enrollment approaches, either through the mobile technology, so that people can really enroll to health insurance in a simple way. So that's one aspect in terms of enrollment. And on top of that, it includes the integration of the national data sets for easy identification of the population, so that you can get everybody into the health insurance scheme. The other important aspect on that is on the side of managing service delivery for those who are insured. If you have a weakness in your clinical or patient management information system, definitely that has an implication in terms of the sustainability of the health insurance schemes. So we have heard here there's been a lot of investment in the electronic medical records. So the task ahead is to make sure that these electronic medical records are integrated with the health insurance claims management systems, so that you can easily have a two-way management of the services that have been provided to insured member, but also the health insurance system, claim management system, can have an audit trail to track how the members are being managed across the facilities. We heard here the EMR has developed a lot in terms of the public sector, both in the primary facilities, but also at regional and tertiary hospitals. With health insurance, it's also touching the private sector. So we still have a very huge task to make sure that our EMR systems are coordinated or talking to each other with the private providers as well. Because with the health insurance to be efficient, it has to be able to manage the patient information in the private sector, but also the patient information in the public sector. To me, this is still a loophole. Currently, we don't have like a national data set that will follow patients from public up to the private. This is a very important information as we are moving towards universal health coverage, because without these details, you will not be able to be efficient in terms of designing the health service benefit package that address the needs of the communities. So we really need to do a lot on that aspect. We improve the AMR, but also make sure that there is an integration with the private sector in terms of patient management information systems. So I'll end here, Moderator. Thanks.
Thank you very much, Jamini. The linkage between the public and the private sector is critical as we are now moving towards the universal health insurance with about 65 million people. We need a system that is robust to ensure insurance, financial, safe delivery are well integrated, especially the enrollment and the claim management. So I'll now move to Ali Abed to add something to the same question.
Okay, thank you, Speaker. Yeah, actually, I'm adding a bit on the point that my colleague here, Dr. Jamin, said that we have MRs and ZHSF, like NHIF, as a service buyer for members. We have our systems. Integration of our systems with the systems of service provider is a critical point that we need as part of our movement towards digitalization of the system. But that one does not end to the service providers. There are other platforms that have rich information about the community. We need to integrate with them because the information we need should be dynamic. And we don't have to go back to the community at some point, maybe after 3-4 years, want to update the information. If there are other platforms where we can have information direct from them, it's just a matter of integrating them. And that point will also help us in identifying the members. So if there are authorities that are responsible for maybe registering the community, then we should not take that burden to register them, just take information from them and use for our purpose. So integration should be covered. For our case, we have started this. We have integrated our identification or authorization system with the ZAN ID system. So our member he or she don't have to go to the service provider with the ZHSF card. Only the ZAN ID card can use it for accessing the services. So intending to do it for other platforms like NIDA and other platforms similar to that. That is one point. But another point is nowadays, I tend to be corrected, but the use of mobile application has surpassed the use of personal computer applications. So if we use mobile applications, we will reach the larger community than we previously used to use computers. So we are focusing on using more mobile application to reach the community and also to advocate and raise the awareness to them about the services, where they can get services, what are the benefits, and things like that. So that is our intention, and this is still a gap for us now. We can use it even for enrollment of members and updating their information and things like that. But also, besides that, we have artificial intelligence. That is another area. Nowadays, if you look at the trend we are going, the service providers may submit their claims and they may receive their payment 2 months or 3 months later. And that is only because the claims vis-a-vis the number of human resources that is there to process those claims is not matching. So to reduce that, if we use artificial intelligence in our systems, most of the works that are being done by this staffing can be automatically done by the system, and then we can reduce the time for paying back the service providers. So those are the 3 areas which I think I can add up to what my colleague Mr. Jamin has pointed. Thank you, Moderator.
Thank you very much, Ali. We have taken note of the use of emerging technology in claim processing, but also in order to ensure system usability, in HI we have to consider different ways of equipment, but also the infrastructure. But also you have highlighted the integration needs, because people have different systems with different standards, different architecture, but they're all housing the information of the people we serve. So that is really critical. So that gives you an opportunity to go back to the two directors of ICT from mainland, Director Ilomo and Director Eric. Maybe I know we'll have chance for the audience to ask some questions, so we'll try to be quick, maybe 2 minutes each, one of you. My question goes like this: how can a collaboration between development partners, the government of Tanzania, and the private sector be effectively utilized to bridge the existing gaps? We have all heard today different gaps, including the capacity building, the internet connectivity, the infrastructure that have been mentioned by Zanzibar colleague here, and working tools that hinders efficient and effective use of the existing strengthened systems. I'll start with Eric.
Yeah, thank you. Collaboration, a simple definition, is working together. But once you put in practice, it's really difficult. But utilization and rollout of GoToMIS give us the vivid example of collaboration. For instance, right now, using GoToMIS, you can track a patient end-to-end, from where is entering the facility to where is getting out of the facility. And right now, within GoToMIS, by bringing different stakeholders, partner, government, within and across, we have been able to put a lot of functionality within GoToMIS, and right now you can even do the referrals, you can even do the client feedback and all that. Now, due to collaboration within different partners, government and development partners, with collaboration, one, you can attain harmonization, process harmonization, and people harmonization. Two, you can attain alignment, policy alignment, vision alignment, budget plan, and priority alignment. And three, we can attain prioritization. You know, if you have different priorities, it's really difficult to attain whatever we want to attain in digitalization. And fourth, we can, using collaboration, we can avoid duplication. You know, sometimes not even duplication, but rather triplication. Yeah, we have a lot of systems across, everyone is doing by himself or herself, and silos. And lastly is pilotitis. With collaboration, we can avoid that. We can come together and having one thing, one vision, one goal, and attain whatever we want to attain in digitalization and data use. Thank you, Makunda.
Thank you, moderator. As what director said, that collaboration is working together, focusing, achieving same goal. So the ministry, what we are doing at the policy level is like developing some mechanism where collaboration could be smooth process. So what we did is there was an establishment of PPP desk where digitalization is a part of it, where most of the private sector want maybe to collaborate with the government, they are going through that channel, and then we set some agreement, and then we set goals, as what Director Kitali said, with a single focus. But also through development of these different frameworks, we are making sure that we are engaging private sector, developing partners, implementing partners, all of them together. So when we are setting the agenda, we all to make sure that all of us we are having same agenda on where we're supposed to go, what do we want to deliver. So in that side, we do like that. But also in a perspective of maybe deploying digital system, I'll try to be specific from the very high level perspective of this kind of framework and whatever. What we did is we engage the private sector for real. For example, I have a good example of unified community system, where through USAID support, we really making like harmonization of all implementing partners, all donors, that's in a community, one system. So unified community system is a good example, is what presented by my brother, Wenga. You can see when you have a single vision, it helps us to get a quality product like that. but also for Minister of Health in the perspective of regional referral hospitals and higher level and tertiary hospitals. We had like different EMRs that deployed in a different regional referral hospitals. So what we did is like we did an assessment to oversee how best we can have a good approach to collaborate with the private sector, so that we can have a single system that's deployed all over the facilities. So you may find right now we have engagement with GPITG company where we deployed AFA EHMS throughout the regional referral hospitals. So now one facility level, one system. So you may find that it's a kind of a very big advantage of collaboration. Thank you, Moderator.
Thank you very much, the two director. Single focus, engage the private sector, develop a common vision among stakeholders, but engage early, engage often, and constantly. Yeah, so with that, because we don't have a lot of time, please allow me now to ask the audience if they have few questions to ask my panelists. So, Anna, you can pass the mic. We still have more questions here, just in case you have.
Thank you very much. Marsha Makatayambi with the UN Global Compact Country Office. Na pia ni yule rais mwenye small r MUHAS convocation. Mine is one. Kwanza mnijibu tu mara moja. Huu mfumo tumefanya wenyewe tangu mwanzo mwamwi. Huu mfumo mnaniadisia hapa. Support ya money au pia na mfumo tumetoa tukatohoa wenyewe from the beginning.
Mfumo upi sasa?
Hiyo yote mwanzo mwisho mmekaa mnaongea mifumo tangu mwanzo, PS3 Health Forum.
Basically yote tumefanya.
Mtanisamea mnaojua Kiingereza. Kwa wale mlikuwa mnasikiliza, tumesikia jinsi ambavyo tunajipambanua kuongea kuhusu kuondokana na rushwa, corruption, risks za aina hiyo. Hili ni jambo kubwa sana. Na nadhani itufike mahali tuwe na many cases across the country ambapo tumeweza kutumia resources zetu vizuri. Hata na zile za dona vizuri. Kitu kingine ambacho pia naomba, inawezekana sio maswali. Kingine ambacho pia naomba ni kuangalia jinsi ambavyo the linkage ya the 10th principle ya UN Global Compact inaongelea kuhusu anti-corruption. Na anti-corruption is part of the elements ambazo zitatusaidia kwenda na agenda 2030 kwa haraka zaidi na vizuri. Ni hayo, tunashukuru sana.
Thank you very much, moderator, and my dear past participants and our speakers. I don't have any question rather than to comment on the very big progress which we have made in improvement of the digitalization in Tanzania, specifically on health. I've been in health sector since 2013 as an economist, but if you want to write an history on where we are right now and where we are coming from, there's a very big improvement. Very big improvement. I used to tell my brothers here, Eric and Ilomo, people need water. So if people need water, Ilomo and Eric must prepare, must develop the infrastructure so that that water can be tapped by the users. They have tried a lot. They have done a lot with the support of our development partners, USAID, PS3. So this good story which we are hearing today, we appreciate as the user of those water where they have reached it today. That is one. But as Dr. Jebeni say, we have a long way to go because right now the UHI bill have been approved. all citizens in Tanzania, they are supposed to be enrolled in, health insurance. Is the system which are in place can support that? To help the service provider to service the citizens of Tanzania, both mainland and Zanzibar, who are now going to enter in universal health coverage. So that is the challenge which we are having. That's a area where we need to discuss as a key stakeholders in this area. I believe all of us are the key stakeholders in digitalization. All of us are key stakeholders in make sure that the universal health coverage is attained in Tanzania. So let me pose, how are we going to use our systems to help the implementation of universal health coverage? Thank you very much.
Yes, good evening. I think it's evening now. Yes, I'm Kesale. First, I'm proud of the investment which have been made by the USAID PS3 Plus and the government for improving this system. They've mentioned the 3 ones. But my question is that for we, in many contexts, you see like we have systems, but our people are not prepared. Our mindset, it means our, whether local government or our public sector employees, their mindset are not prepared to go along or to power today. Or the system is low, is not functioning. So, and then at the end of the day, you fail to utilize or to the investment that have been made to make the value that you intended. So my question goes to Eric and Brother Ilomo. Do you think, or have you put in place some strategies to make sure that there is enough support to our employees, and then also we have transformed their mindset to make sure that, okay, they have capacity and then they can use the capacity they have to make things happen there? Thank you.
As my takes to you or to all of us, one, it's about skills. We know that we are here implementing, or we are trying to see how this thing can work, but at the area of the field or at the field work, we still have loophole on skills, especially on health facilities or community health workers. Some don't have knowledge mostly on how to use these, maybe computers and alike. Currently, I know we are doing a lot of outreach to reach these people and teach them on how to do, but I have to foresee this on the coming practitioners or the ones who we are still mentoring them at the universities. Why, or I think, why shouldn't we put this in a system or curriculum? Whoever that is going to practice in any way on these systems, maybe lab techs, doctors, nurses, and whoever, they should have a curriculum that needs them to learn on these systems, or on the system that will be up to date on that time. This will make us reach easily, or when a person goes to the field work, not to take time to be mentored again with those who are there, and this will also eliminate the problem that Kesale has said. That's one. Then second, Dr. Jamini said we have a loophole on how we can connect public and private sector, like a national health code, a code that everyone is sick and everyone can attend a facility of his or her choice. I will attend probably a private hospital using that code, but when I go attend another hospital, be it public or private, when I enter that code, my informations and data and everything that was prior to my, maybe easy at least, to ally these sectors together. That's my take.
Asante mwenyekiti. My name is Rose Mpembeni. I am from Muhimbili University. I think my question goes to the director of DICT at PORALG and others. First, I have to thank you all the panelists for good presentations, but also for the actual work of digitalizing the THS system which you are doing every day and which you have presented to us today. Now, my question is, we are trying to improve service delivery and reporting. Is there a way of harmonizing these digital systems so that we relieve a healthcare worker the burden of entering different systems? We all know that we have THS 2. Now we have GoToMIS. We have CTC. We have ETL. So all these are different systems, and a health worker can be required to use one at any one time. Is it possible to harmonize so that we can ease the work of these healthcare workers at the place of work? Thank you.
Apologies, we lost about 20 minutes from the previous session, so we'll try to provide opportunity to our panel to respond to some of those questions.
Thank you, moderator. Thank you, participants, for their questions. So I will start by providing some insight on some of the issues that has been raised. Director Macha has raised concerning regarding to what has been told with even Dr. Jamin, UHC, preparedness with regard to digital system. So as all of us, I know some of us are technical, some are non-technical, but what I can say is digital systems are flexible to accommodate changes, and basically that is one of the aspects for the quality of digital systems that should be deployed. We should have systems which are flexible to receive wherever there's changes, because we always know that users' requirements are dynamic every day. So when we are developing digital system, we are ensuring that we have a system which is dynamic to receive changes at any time. So regarding to UHC, it's not one sector approach. It's a multi-sector approach. We know that there's issues with what has been mentioned by Dr. Jamin, identification. So we have to integrate what we have as EMR, like whether after EHMS, GoToMIS, wherever. We have to make integration with a system which are available at the National Identification Authority, NIDA, to ensure that the same client who has been attended from one facility to another is the same by a common identifier. The second question is with people awareness, digital system infrastructure. I just leave this to Director Kitali. And maybe I would like to make a touch with question, the last question, with the harmonizing. Yeah, basically, even from our side, we thought that having this multiple system at operation level, it's somehow hectic for sure. We know that because it's a burden for the healthcare workers. So we have started like making sure that we are integrating our existing EMR with aggregate data system like THS2 and whatever, to make sure that people from the facility level, when they entering data, they are not supposed maybe to re-enter the same data again in the paper-based. So we have started the process, and we have already made like a proof of concept from the regional referral hospitals. For now, like if you go for the hospital like Amana and Mount Meru in Arusha, they have already started, like they're just entering the data once, and then they pushed it to DHS2. So we just set like a proof of concept to make sure that we are going to adopt this kind of methodology to all of our facilities. Also, I would like to make a touch to Dr. Justina, what she said regarding to skills in how to accommodate maybe this kind of providing skills to maybe proper curriculum. It started like in the perspective of data management. I know Director Mache is outside, but for the HMIS, like now they've been collaborating with the Mzumbe. They have provided some insight on that regarding to issues with capacity building, skills, and whatever. So even for digitalization, we started at some point, but it's not ready for deployment. But for sure, we have that plan. Thank you.
Yeah, thank you. Just to supplement on Ilomo's, from Dr. Rose, what Ilomo said, right this moment, harmonization is a must, is mandatory, is the directive from the president. So there's no way out. We have to do it, whether we want or we don't want. So it's going to happen. Kasele, why are people not ready to use the systems? First, maybe the support is very poor, the support which are giving them, maybe fear of unknown, maybe the capacity building and all that. So we are doing that. And what we are doing, we are even put the indicators. You know that, which is easier for us to monitor and evaluate whatever is happening in terms of system utilization. Lastly, on the corruption and uses of the system reports. Actually, if you are analyzing the trend of CAG reports for the past 10 years, recent reports you find they are so deep. They are deep because they are using the systems. So it's easier right now, the CAG and internal auditors, to see what is happening across. Right this moment, if I open my computer, I can even see all the transactions across the country, across all the facilities, 35,000 plus facilities. So we know once the transparency is very high, if we increase the transparency, we are sure even we can reduce corruption. Thank you very much.
So, ladies and gentlemen, as I promised you in the beginning, we are going to have a very interesting conversation. I think you've all seen this today because of the immense experience and the insight of the work they're doing in the public system. So on behalf of our panelists, I'd like to welcome Dr. Gemini to provide some closing remarks.
Okay, thank you, moderator. So in my closing, I'll just reflect on one aspect of capacity building. We are trying to use also the digital platform to simplify capacity building. So from the training materials, we have uploaded them into the online distance e-learning platform, which is under the Institute of Local Facility at the community. They can just log into their mobile phones for these systems. So there are different options to simplify the access to this system. So with that, my closing remarks.
Thank you so much for your time. And